This is the photograph which have got lot of means. This picture shows a lot about the father's effort, but the kid only see the mother's love because the mother's is eyes are in front of the kid and the kid can see only the mother's love. But the effort which the father is doing while lying down on the ground to make them reach to that point is not able to be seen. So that is being considered not much effort as compared to the effort of the mother. Now coming back to the point, earwax prevalence of impacted earwax is different across the world. In UK it is about 2 to 6% and in USA it is 3.6% and in Brazil it is 8.4 to 13.7%. And how one is going to diagnose that? Diagnosis on physical examination or your visual examination, wax is visible in the ear canal. On otoscopic examination or the physical examination with the head mirror with bull's eye lamp, one can see clearly the brown color wax seen in the ear canal. Tympanic membrane is not visible due to the excessive cerumen, and with tuning fork, air conduction and the bone conduction can be checked to see the level. Here one can see the earwax here and here with the bull's eye lamp and the mirror one can see that. And this is the otoscope that putting the light in the ear canal and one can see the wax inside the ear. Similarly, one can use the tuning fork to check the conductive toughness which this wax is producing, and then we have to have the treatment. The following methods of the earwax removal are effective, and these are: number one, auto cleaning, use of the softener, physical method, singeing or the irrigation, suction, ear candling, and the microscopic removal. First, we are going to have the auto cleaning. Movement of the jaw helps ear natural cleaning process. Auto cleaning process, the American Academy of the Otolaryngology discourages earwax removal unless excess enough and that is causing the symptom. So there is no need to get remove the earwax if it is not troubling. The second method is the use of the softener. These are called ceruminolytics that just soften the cerumen. This process is called ceruminolysis because it just causes the lysis of the wax. Topical preparation for the removal of the earwax. Many softeners are effective and not much difference between the types that include water and olive oil also being used. Softeners, these are commercially or commonly available that include urea hydrogen peroxide 6.5% and glycerin, a solution of the sodium bicarbonate in water or with glycerin, cerumol, that is the peanut oil, turpentine oil, and dichlorobenzene mixture that makes the cerumol. Then cerumanex, that is the triethanolamine, polypeptides, and oleate condensate that makes this preparation. Docusate, an emulsifying agent, an active ingredient found in the laxative, also being used at ceruminolytic. Mineral oil. A ceruminolytic should be used 2 to 3 times daily for 3 to 5 days prior to the cerumen extraction. It is usually said the rule of 3. 3 drops 3 times a day for 3 days. So that makes sufficiently the softening of the wax to be easily irrigated by the suction or by the other irrigation method. Now, here are one can see the softeners: olive oil, eardrop, cerumol, eardrops, then earwax, aid, and the soda glycerine. These are the different preparation which are being used to make soften the ear wax. Then the physical method, also called the manual or the mechanical removal of the wax. The method was used in the ancient times. A curate is used by the audiologist or the otolaryngologist when ear is partially occluded, material is not adhering to the skin of the ear canal, and ear pick curate physically dislodge the ear wax and scoop it out of the ear canal. Best for the Asians with the dry type of ear wax that can be easily removed, and the large pieces and one piece big is in the form of dry flakes can be removed easily by the physical method. And here is the Jobson horn probe, which is meant for removal of this wax that have got this different sizes and different shape, which is going to help the make it out. This is how in the ancient time the wax was removed by the so-called audiologist, and nowadays the trained audiologist are using this job to make clean the ear. Physical method, not use cotton swab, Q-tips or the cotton buds. They push the wax further and they cause abrasion of the ear canal and can perforate the eardrum. Now, when the water enters during swimming or the bathing, that can lead to the ear infection. Also, cotton head can fall off and the lodge in the ear canal in the form of foreign body that you have to remove, and that remove only a small portion of the top layer of the wax that adheres to the fibers of the swab. So use cotton swab to clean external ear only when the wax is out. So here one can see the cotton swab that is going to use to make out the wax, but it can accidentally perforate the eardrum. So the advice is do not use Q-tips for your ears, and a qualified person can use it properly, knowing that he or she is not going to damage your tympanic membrane. So this is all the mechanical removal. One can use the probe and to make the wax out. And here you are seeing a photograph. It looks like to be the small child inside the apron or sometime in the incubator. Actually not, it is the God-made flowers that looks like these small kids inside the flower bed. So this is the God-made beautiful flowers. Now, ear irrigation or the syringing, that is the fourth method of cleansing the ear wax. Once cerumen is softened, remove it by the irrigation. Nowadays, spray type ear washer at home with the bulb syringe is available. Here, pull external ear up and back. Aim is the nozzle of the syringe upwards and backwards. So water flows along roof of the canal. The irrigation solution flows out of the canal along its floor, taking wax and the debris with it. Solution to be used should be isotonic warm water, best the normal saline, with gentian violet in it, so that if some water is retained inside, it is not going to have the fungus because of the presence of this gentian violet. So these are the ear irrigation syringing. These are the pumps of the different size that can be used according to the size of your ear and your need. And here is the metallic syringe that can also be used to syringe out the wax. Syringing, irrigation, as one can see, the water flow is just toward the upward to get it clean, the whole eardrum, and is coming back from this ear canal, taking away everything which is just retained there up to the tympanic membrane. But the pressure should be sufficient enough not to hurt the tympanic membrane, but to get out the debris which is there and the wax which is there in the ear canal. So continuing the ear irrigation and the singeing to avoid bacterial fungal infection afterward, sodium bicarbonate solution or the solution of the water with vinegar, and aim is to prevent secondary infection. Irrigation solution to be warm to the body temperature, otherwise there are the chances of the dizziness, which is very common if the ear washing or syringing is done with the fluid which temperature is above normal or below normal, colder or warmer than the body temperature, that is responsible for causing dizziness. Irrigation and the manual removal is equivocal, but the manual removal can be done only by the very experienced and the expert hands. Here, the irrigation system that can be used at home. Here again, you can put the nozzle inside and give the pressure of the water and make out the syringe. But again, it have to be very carefully, not too strong push of the water to damage the ear canal or the eardrum. Suction or ear vacuuming. Here different kinds of the suction tips of the plastic or the metal are used, which are connected to the machines which work like the vacuum cleaner. Machine create different level of the suction. One have to be careful in selecting the suction pressure. Otherwise, if the strong suction pressure is being used, I have seen the many people using the strong suction and making suck the drum out with the suction tip to make someone permanent deaf. So stronger suction can suck the eardrum, which will make the patient permanent deaf forever. So please be careful. One have to be very much careful regarding the use. These machines are very good, but it is just like the gun in the hand of a soldier and gun in the hand of a layman. That makes a lot of difference. So here is the suction machine, suction tip. You have to select to see the wax and then to make it out, as this audiologist is doing very carefully under the supervision. Ear vacuuming, that is also, that can vacuum the ear, but again the vacuum should be not very strong to damage the ear. Ear candling, it was past, it was being used but not used nowadays, also called ear coning or the thermal auricular therapy, an alternative method to improve general health by lighting one end of a hollow candle and placing unlit end in the ear canal. It is both dangerous and ineffective. American Academy of Otolaryngology do not recommend it now. Food and Drug Administration have also banned it and against it. That is just, one can see in the past this was being put in the canal and it was burned and said to be that is going to take away the wax, but not used nowadays. Microscopic cleaning, when all the other ways of cleaning the earwax fail, one can give general anesthesia to the patient and the wax can be removed as a last method under the microscope, under the direct vision. It is not an outdoor procedure but an indoor procedure. Patient have to be admitted in the hospital and to be in the operation theatre for this procedure. As one can see, these things are available only in the operation theatre, and that is how this microscopic cleaning of the ear is being done. Now, there are certain uses of the wax, whatever the God Almighty have made, but it is said to be that earwax and the other substances like urine were used to prepare pigments in the past by the scribes to illustrate the illuminated manuscript in the past, in the 14th century or perhaps before that. Earwax, when applied topically, cured the bites from the humans, scorpions, and serpents. Though it was auto recovery, but it was said to be that this earwax application has certain role. It works best when taken from the ears of wounded person itself. it is all the theories which were at that time prevailing. The first lip balm have been based on the earwax. Before waxed thread was available, a seamstress would use her own earwax to stop content of the thread from fraying. So that was being used for the seamstress to just make the thread, use it for the proper purpose to make it streamlined for the use. And that is end for the earwax. And I hope you may have liked it. If you have liked this, please subscribe it and share it with the others. If you don't like it, you can call me, and you have the right to have any kind of the comments on that. And I do not hesitate to improve that. And I will appreciate whatever the question and the query if you do have. And thank you very much for watching patiently.